Okay, so we're on unit number 6 now, or video number 6 in the playlist. This is about intrauterine devices. These are long-acting reversible contraceptives, otherwise known as LARCs, and you can see they're these T-shaped devices that you insert into the uterus. And the original one was made from copper. It's implanted in the uterus by a provider, goes by the brand name of Paragard. Copper ions are released into the uterus and they have a spermicidal action. Also, there's a mild inflammatory response inside the uterus that creates a hostile environment for sperm. So the sperm never meets the egg. It's effective for 10 years. Failure rate less than 1%. It's approved for emergency contraception, can cause increased menstrual bleeding and cramping, can be used by breastfeeding mothers with no impact on milk supply. It is completely reversible, but the patient should be tested for STIs and pregnancy. If the patient is pregnant, this is contraindicated. If the patient has an active STI, she needs to be treated first. It has a high initial cost, $500 to $1,800, but over time, over 10 years, this is cost effective. It could be free, depending on your insurance. This method is inappropriate for women who have a history of pelvic inflammatory disease. In the old days, back in the 70s or 80s, I think, historically, some of these were associated with toxic shock and pelvic inflammatory disease, but the newer ones carry very little risk of that. If they have fibroids, it can aggravate bleeding from fibroids. Certain types of cancers that affect the reproductive tract, like cervical cancer, uterine cancer, and anybody who wants to be pregnant in the next few months or, less than 10 years, really. All right, now we have our levonorgestrel releasing IUDs, or intrauterine devices. They come in different dosages. Mirena and Liletta are higher dosage. Skyla is lower dose. T-shaped device that releases a small amount of levonorgestrel into the uterine cavity. It creates an inflammatory response that is toxic to the ovum and sperm. Thins the lining of the uterus. Mirena and Liletta are good for 8 years. Skyla is good for 3. And they're always pushing that a little bit longer as they're learning more. The insertion can be painful. There's a lot of literature right now about pain relief during insertion. Used to be they told you take a Motrin and that was it. But usually you don't feel it afterwards. Treat your STIs first and do not insert if there is a pregnancy. Irregular menstrual bleeding, yes. Usually it's very decreased. It can be a little irregular in terms of length of, time between bleeding. It's usually spotting, but there is a significant percentage of women who will stop having periods altogether with this method. The cost out of pocket is about $1,300, and the same considerations, abnormalities of the uterus, including fibroids, women who've had infections of the uterus within the past 3 months, like postpartum endometritis, active cervicitis or vaginitis, cervical dysplasia, breast cancer because of the progestin, or liver disease, again because of progestin. All right, now we have one more unit left, or two.